Welcome to another episode of Plot Conversations from Thrombosis Canada. I'm David Airdrie, Executive Director.
I'm Jamil Abdulrahman, hematologist from Toronto General Hospital.
We're here to provide you with updates on diagnosis and management of thrombosis, featuring interviews with authors of recent research publications and highlights of education programs from Thrombosis Canada. Thank you for joining us for this episode.
In this episode, we'll be discussing a recent paper published in the Journal of Thrombosis and Hemostasis entitled Role of Statins in the Prevention of Post-thrombotic Syndrome after a Deep Vein Thrombosis Event. A systematic review and meta-analysis with authors Dr. Lucia Caiano and Dr. Tzu-Fei Wang. Dr. Lucia Caiano recently completed her residency in internal medicine at the University of Insubria in Varese, Italy, and is currently working in the emergency department and at the Thrombosis Center of the Varese Teaching Hospital. During her last year of residency, she was involved with the Thrombosis Research Group at OHRI as a research fellow, and since 2021 has been involved in exciting collaborations with the Thrombosis Research Group at OHRI in Ottawa. In her free time, she enjoys discovering the world and most of all hiking and skiing in the Alps. Dr. Tzu-Fei Wang is a hematologist and an associate professor in the Division of Hematology, Department of Medicine at the University of Ottawa and the Ottawa Hospital, and an associate scientist at the Ottawa Hospital Research Institute. Her main areas of clinical and research interest include clinical research for the optimal prevention and treatment strategies for patients with cancer-associated thrombosis, drug-drug interactions with anticoagulants, and obesity-related thromboembolism. Thank you for participating in our podcast today.
Yes, thank you.
Thank you for having us.
Terrific. I'll start off by asking, can you give us some background on what post-thrombotic syndrome is and if it is preventable?
Post-thrombotic syndrome is a form of chronic venous insufficiency secondary to prior DVT. Pain, itchiness, cramps, edema, and discoloration are at the affected leg are the frequent manifestation of PTS. This syndrome is not lethal, but it can significantly impact the function and the quality of life of patients. I would say that we don't have effective prevention or treatment strategies for PTS at this time, other than an effective anticoagulation. In fact, half of the patients with DVT are expected to suffer from PTS within the first 1-2 years, despite a correct anticoagulant treatment, elastic compression stockings, or physical exercise.
I would just say that I would agree that PTS has been really kind of a major complication of DVT. I think that recently CAM Vector has a Clot-10 kind of top priority from patient advocates, and how to prevent and treat PTS, post-thrombotic syndrome, is definitely on the top 10. So it's a very important topic for us to study.
Good, thank you. So statins are widely used in arterial disease, but where did the idea for statin use to prevent post-thrombotic syndrome come from?
So inflammation might be considered a prothrombotic factor, and its management may help not only preventing arterial cardiovascular disease, but also VT events and their consequences. Statins have principally lipid-lowering properties and also some effects on inflammation and coagulation. Some observational studies showed a reduction in the risk of VTE or VT recurrence in patients on statins for other reasons, for example, cardiovascular issues. Similarly, the anti-inflammatory properties of statins could be protective against PTS.
Great. So you performed a systematic review and meta-analysis on the role of statins to prevent post-thrombotic syndrome after DVT. Can you tell us what type of studies and patient population you were targeting in your search?
Yeah, so we included RCTs and some prospective or retrospective cohort studies evaluating adult patients with VTE. So it was DVT with or without pulmonary embolism. Patients who received anticoagulant for a deep vein thrombosis with a statin. So we compared the group with the statin or without the statin treatment. And the selected studies were 3 RCTs and 2 retrospective core studies. And everyone assessed the PTS using the Villalta scale as index of diagnosis and severity.
Okay, great. So you mentioned you found a few RCTs, some observational studies. Can you tell us about the risk of bias in these studies?
In our systematic review and meta-analysis, we have 3 RCTs. 2 of them were considered to have a high risk of bias, especially bias due to the outcome measurement. And we used the Cochrane risk of bias assessment tool. The observational studies had a similarly high risk in bias. Both of them had serious risk of bias in at least one domain of the Robin1 tool. So it was bias due to the selection of participants and measurement of outcomes.
Okay, so you looked at the effect of statins on the presence of post-thrombotic syndrome, defined as Villa-Alta score greater than 5. And the severity of post-thrombotic syndrome, defined as Villa-Alta score. And you also looked at safety outcomes of statin intolerance and major bleedings. Can you tell us about your findings in the study?
Yeah, so exposing to statins seems to be associated with a significantly decreased risk of PTS, reducing by 22%, with a very low muscle toxicity. And considering the 3 RCTs describing the Villalta score at the end of the follow-up, we found a mean score of 4 in the statins group and a mean score of 5.6 in the control group.
I would just also add that we also calculate the kind of poor incidence of post-thrombotic syndrome. It's about close to 35% in patients receiving a statin, so 35% per patient year, and about 42% per patient year in control, so that's in patient without statin. So overall, that's where when you compare to them, that's where you see the incident rate ratio of about 22% reduction. Overall, this is combining both randomized control trial and observational study. We also calculated the number of needed to treat of using statin to treat one PTS is 21.5, so about 22.
Okay, great. So you said that's the findings for overall, but you also did subgroup analyses looking separately at the retrospective studies and separately at the RCTs. Can you tell us about those findings?
Yeah, so our main results are more driven by retrospective studies. The meta-analysis of the 2 retrospective cohorts found a significant reduction in the risk of developing PTS, whereas meta-analysis of RCTs showed a modest and non-significant reduction in PTS occurrence. So PTS risk was not reported according the type of setting and in the retrospective cohorts.
Yeah, so in other words, we actually see more significant result in the observational study, and it's study from randomized control is actually not significant. That's why we say that the results are more driven by the observational studies. But one should also take a note that randomized control trial obviously it's harder to do, so it's smaller. So it could be that it's just not power enough to detect the difference.
Right, great point. So what were some of the limitations of the systematic review?
We have maybe a few points to discuss in this answer. So first of all, the positive association between statins and decreased risk of PTS was driven by one large but retrospective observational study with serious risk of bias and confounding by indication. Secondly, the total number and the quality of the studies and the number of participants that could be meta-analyzed were limited. Nevertheless, there was no statistical heterogeneity among studies supporting a potential effect of statins on PTS prevention. Also, publication bias cannot be ruled out. and the assessment of PTS in different studies was not performed at the same time point after the index DVT in all studies. The duration of exposure to statin may play a role in the incidence of PTS. Finally, to calculate annual pooled incidence, we made some assumption to obtain the number of person years of follow-up, as it was not provided directly by some studies. And we were unable to account for the presence of distal DVTs in the studies included in the meta-analysis, which is a potential confounder.
How should we interpret these findings clinically? Do we need more data before considering statins as a viable agent for post-thrombotic syndrome prevention?
Yeah, so the favorable risk-benefits balance of statins in the setting is clinically considerable. Statins are safe because they do not increase the risk of bleeding in patients treated with blood thinners. More data are obviously needed to assess if it could be a valid option for prevent vein damages.
And I'll just add that I think that we definitely need more data, and certainly randomized control trial is always the gold standard. I mentioned that even though in our sentiment review, we found some randomized control trial, but they are quite small. So again, the power may be an issue. So I think what really can help us to define future practice is really a large randomized control trial that I'm sure many people are aware of the SAVOR study. SAVOR trial is ongoing. That's led by Dr. O'Gillian, Luke, and Dr. Mark Roger. It's ongoing in international side, started in Canada. So we're quite excited and really hoping in the next few years we'll have a better answer.
That's great. Thank you. Is there anything that we haven't discussed today that you'd like to add?
No, I don't think so. And thank you for this opportunity to discuss this paper.
Yeah, thank you for the opportunity. I think this kind of we were really it would be interesting finding out. Yeah, statin. We always think that it's pleiotropic to see if that we can use that utilize that property to help our patient with blood clot.
That's great. So thank you both for participating, agreeing to participate in our podcast today. And to our audience, thank you for listening to Clot Conversations from Thrombosis Canada. We welcome your comments, questions, and suggestions on the podcast. And if you have any recommendations for future podcasts, please send them to us at info@thrombosiscanada.ca. And please subscribe to this podcast so that you are notified about the release of new episodes. Don't forget to check out our website, which we've just launched our new website. So check it out today for education programs, clinical tools, and guides. Also, please consider donating to Thrombosis Canada to support our ongoing efforts to reduce morbidity and mortality due to thrombosis. Thank you both.
Thank you.